In Kerala, 3 people have lost their lives to the deadly Nipah virus. In fact, 6 other deaths are suspected to be due to the virus, but doctors await confirmation on this. Nipah virus is spread by bats. An expert team of doctors have been sent to Kozhikode to monitor the situation at the moment. Vivek Karindalam joining me on the phone line. Vivek, it seems the virus has spread to quite a bit, since we are reporting that there are 25 people under observation. 9 lives have been lost, out of them 3 confirmation. Now, is that the latest status? Can you please update us?
Yes, yeah, as you said, 9 people have lost their life, of which 3 people are, confirmed that they have been infected by Nipah virus. But one thing that comes as a, a huge reprieve right now is the situation is right now under control, and the people who are under observation have come down from 25 to 10,
okay.
Which means now it's only 10 cases which are something that has to be serious, and the rest, 15 has been relieved from the hospitals. But yes, of these 9 people, of these 10 people who are under observation, yes, there are a few critical cases, but the doctors are looking after them. It's a 24-hour surveillance over there. All especially all departments are under alert right now, and a team of doctors will be in Calicut any moment from now, from Delhi, and they are going to ascertain the situation. Yes, Nipah virus, something that's unknown.
I have Mr. K.K. Aggarwal, former IMA president. Sorry, interrupting you there, Vivek, to bring in Mr. Aggarwal. Good morning. I want to understand from you the seriousness of the issue and what advisory can we give citizens of Kerala, and what are the symptoms that people should be wary of?
See, Nipah virus causes encephalitis. It is just something like Japanese encephalitis, everybody has heard name.
Okay.
So in whichever case you find that Japanese encephalitis test is negative, you suspect is it something else, then Nipah encephalitis is one of them. In 2001, there were a lot of cases in Siliguri in West Bengal. This disease is endemic in Bangladesh and in Malaysia.
Okay.
In Bangladesh, you get these cases, so it is easily transferable cross-border from Bangladesh to West Bengal, where cases come. But shifting it to Kozhikode, that means near Trivandrum in Kerala, whenever in any state new cases come, by definition it's an epidemic. Therefore, the team from Delhi, Nandaji has sent a team.
Okay.
And there is an advisory to all the doctors in the country to read about it, because to see cases of, if any case, ask people have they traveled in Kerala during this period. So anybody who has traveled from Kerala near that area, and if he develops a fever after 14 days, one should keep it in mind, because such cases, surgical strike need to be done and they need to be isolated, and so that they don't allow the spread. And because there is a human-to-human transmission, so epidemiological, preventive, public health precautions needs to be taken.
Right. So right now, Dr. Aggarwal, this is an outbreak which is confined to Kerala. Can we confirm that to our viewers? To what extent has the virus spread?
Absolutely. There are cases in Kozhikode. Few deaths have occurred, and therefore this is, yes, epidemiologically there is a local outbreak in Kerala. Therefore, in Kerala, anybody who is developing fever, and in those areas where the disease is there, if there is a fever, yes, the government is supposed to, they have already made fever clinics. They need to go there, and then the government need to take action. This is a public health problem. This is a public health problem. Therefore, public health is the responsibility of the government to take care of.
Right. So what are the immediate challenges? What are the immediate concerns, sir? Because there must be efforts on to restrict the spread of the virus and also to make people aware. What are the immediate challenges that you're dealing with?
Let the disease not spread from the area where it is occurring, because it can follow the beds. Therefore, do not eat any fruits lying on the road in the villages or near the trees. And also, any case of fever need to be reported to the public health problem. I'm sure that the Kerala government is going to make it notifiable immediately, so that every case is reported and every case is checked, so that the spread can be checked.
So this is in fact a major concern.
The ministry needs to decide. The ministry need to decide whether to allow patients from that particular area to travel by air or not, that advisory need to come from the ministry. But
Okay.
yes, all doctors in the country, if they see a patient with fever who has recently traveled Kozhikode or nearby area where the disease is spreading, a high degree of suspicion is required.
Okay, so many thanks to you, sir, for giving us that clarity, because this is something that spreads human to human, and therefore that many precautions have to be taken even to isolate patients who are identified of having contracted the virus. Thanks for joining us, Mr. K.K. Aggarwal.